A Fox News alert, you're looking live at Nebraska, the Nebraska airport where Americans from the Hantavirus cruise ship just landed hours ago. They're going to be quarantined and monitored as U.S. officials are expected to hold a press conference later today on the outbreak. We now know one American has tested positive for the disease. Another is showing symptoms. All as a French passenger has also now tested positive for the virus. Infectious disease physician Dr. Amesh Adalja joins me now. Doc, do you trust this quarantine unit in Nebraska to keep the virus from spreading?
Yes, it's the best in the world. This is a place where they've taken care of COVID patients that were repatriated after the Diamond Princess. This is a place where there's a biocontainment unit nearby that took care of Ebola patients, and these are some of the top infectious disease experts in the world at Nebraska. So I do think this is something that can be contained, and I think Nebraska is a good place to start to do this work, and we'll see how this plays out. But remember, we're expecting to see cases amongst the passengers, so it's not surprising that a French passenger, an American passenger, and maybe some more will test positive. The key thing is looking for onward transmission, second-generation cases, and there's no evidence of that now because this virus is constrained in its ability to spread from person to person, even though it can do it.
Okay, that was the question that my esteemed co-anchor Carly asked me during the break, and I think it's a really good one. If this thing is quote-unquote not very transmissible, then why is it transmitting itself among people on this cruise ship? Or why was it?
So, not very transmissible doesn't mean not transmissible at all. And what we know is that at least of the initial 8 cases, they all seem to have had close contact with the index patient, the first patient, the man who got infected in Argentina bird watching or in one of those countries that he was bird watching in, and then got on board the ship and then transmitted it. So what we're looking to see is, were people that were in less contact with this person, or were they getting infected? So this is kind of the epidemiological investigation. But I think it's important to remember that just because something is not transmissible at all doesn't mean it can't transmit. So that's how those individuals got infected. They're all part of that initial cluster on that ship, I suspect.
And obviously, Doc, we're a little worried because you remember what happened a couple years ago, a little thing called the COVID pandemic. Everybody this weekend asking me, even though obviously not a doctor, is this COVID 2.0? Here's what the acting CDC director had to say. Listen.
This is not the COVID, Jake, and we don't want to treat it like COVID. We don't want to cause a public panic over this. We want to treat it with the Hantavirus protocols that we're successful in containing outbreaks in the past.
I'm going to assume you agree, Doctor.
I do agree. You have to think about each pathogen, whatever it might be, Mpox, COVID, influenza, Hantavirus, as a distinct entity. Yes, there's some overlap in the measures that you take, but they all have different biology. They all have different transmission characteristics. So not everything can be viewed through the lens of COVID-19 or the lens of a pandemic, and not everything that's a public health emergency means an epidemic risk or a pandemic risk. And I think that's kind of the danger, is that COVID-19, for good reason, conditions how people look at things. But when you look at it from an infectious disease or an epidemiological perspective, you've got to realize these are different things. One virus is very distinct from another virus. They're all not the same, and it's not all interchangeable what the playbook is.
Beyond this outbreak, Doctor, I want to focus on the Hantavirus, not the Andes variant, but the general Hantavirus that you can get from the waste products of a rodent. A lot of us are in spring cleaning mode right now. A lot of us are cleaning up rat waste, mice waste. Is there a concern that in the cleaning process we could aerosolize this and infect ourselves? Is that something that you warn your patients about?
Definitely. This is exactly how most people in the United States get hantavirus. They're cleaning out an old shed, they're cleaning out an attic, a basement, and they're using a broom, and they aerosolize some of those rodent droppings and they inhale them. Indeed, that might be what happened to Gene Hackman's wife when she was infected with the fatal case in New Mexico. And this is where, like, the 20 cases that occur every year, that's largely how they happen. It's these types of exposures that occur, primarily in the southwest of the United States, but hantaviruses are in other parts of the country as well. So that's an important countermeasure to take, is if you're cleaning something out and you think there's rodent waste there, you should probably wear a mask when you do that so you don't aerosolize it. And I've said that for a long, long time when people ask me about hantavirus. They're still rare in the United States, but that's how those cases occur.
Such an important segment in all aspects. Doctor, we appreciate you getting up this morning because I know a lot of people are talking about this. Thank you, sir.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox 1.